All right. Hi, everybody. This is Brooks Lindsay. I am the founder of Debatepedia.org. That's Debatepedia.org, one word. Have a look. We have a pro con article on the public health insurance option that I wanted to cover today, go over. It is probably the most extensive in the world. It draws pro and con arguments and quotations from over 50 of the best and biggest pro and con editorials and opinion pieces and political speeches and statements on the topic. So it's very extensive, and I want to go through it right now. So one of the topics, one of the sub-debates within this larger debate is on competition and choice. So does a public health insurance option provide good choice versus what exists now? A lot of people say, well, hey, there are 1,300 private health insurance companies already. That's plenty of choice, plenty of options. Why add another one into it? Uh, a lot of people say, oh, well, the problem is that these 1,300 different companies, they're very segmented. There are a lot of monopolies. There are a lot of barriers between states, and you don't really have choice. An individual doesn't really have choice between all 1,300. They have a very limited choice, and therefore you have certain health insurance companies raising premiums higher than they ordinarily would if there was a greater level of competition. So why not just add this new public health insurance option? It will increase choices. I think there's definitely a good case for that. But a lot of people say, well, why don't we just try to lower all these barriers? Let's to the private health insurance industry, increase choice, reduce monopolies, increase cross-state availability of these health insurance options. I think that should be done. But there are some certain problems with the private health insurance industry and inherent interest, profit interests involved. This is a major counter argument that many people are making. A private health insurance company has an interest to deny claims, to reduce the benefits that it gives to its customers, to its citizens, people that are in dire need. They might be on a hospital bed, they really need the care. The health insurance industry will say, no, or company will say, no, we're going to reduce back what we're going to give to you, or we're going to completely deny your claim altogether, because they have a profit interest at heart, and they've been growing at almost 20% annually for years now. So they've certainly been making a profit. The public health insurance plan would not have this private health insurance for-profit interest. So they could just have your health at heart. They would pay administrators a fairly low amount, or at least a reasonable amount. They wouldn't pay a high CEO price. They wouldn't pay doctors gazillions of dollars. It'd be fairly, average or maybe a little bit above average. But this would especially lower costs. So when you're talking about the overall costs of the insurance, plans, one of the advantages of a public option is that you don't have those high administrative costs. But the private health insurance industry does have for it the fact that usually in the marketplace things go a little bit more efficiently. When you have a large government bureaucracy, oftentimes costs are just, eh, it's all right. We'll do it. We'll write that check, and no problem. In the private industry and marketplace, usually it's a little bit tighter. So I think that the private industry has that going for itself. But here's the thing: we have 47 million uninsured Americans. How are we going to cover these uninsured? Well, one way, if we were to stick with the private industry, is to mandate that these 47 million get by private health insurance. But is it really fair to mandate that this happen? The private health industry has proven over the years incapable of providing a low cost and good quality service. Uh, you can say this because the United States is ranked 37th in the world in terms of its healthcare, and basically last in the industrialized world. So it's not doing very well. The status quo isn't working. How can you just perpetuate it by mandating that everybody buy private health insurance? And then you would just be mandating that that you'd be perpetuating this for-profit interest when there's probably a good reason to check it with a not-for-profit public plan. I'd say another big thing is the concept of socialized medicine. Is a public option socialized medicine? Well, there's the bureaucracy that's involved, right? So that's the big fear most Americans have. You know, the government, this monolith, is going to be coming in. It's going to be taking over my decisions and all these things, right? Uh, so, if your fear is about the bureaucracy of government, don't you also have a similar fear about the private health insurance bureaucracy that already exists, that's already uh, trying to make your life a little bit harder by depriving you claims and saying no to a good, healthy, you know, payment, increasing your copays and so forth? That's their interest. That bureaucracy has an interest to deprive your claims, increase their profits. Does the government have that for-profit interest? No, it doesn't. So which bureaucracy would you rather have is the main question. So last thing, in terms of quality, uh, what we're looking at in the United States is a public-private hybrid system. So if we look abroad, what is the number one quality healthcare system in the world? It's France. In the United States, you might scoff at that, but it's true. And they have exactly what we would be looking at. Uh, the idea behind a public health insurance option is to create a public-private hybrid system so that the public option exists side by side with the private options. That's what exists in France today. And it's the number one system in the world. So in terms of quality, it looks pretty good. We're 37th in the world. France is number one. They have what we're proposing with a public health insurance option. Why not go for that? I think it's pretty logical. There are plenty of theoretical arguments against it, though. That the private industry, the marketplace is more competitive. It drives greater quality, innovation, investment in innovation, so forth, right? The rewards are there, so the incentive is there. I think that's partly true, but a hybrid system benefits from both that private interest, right? Private for-profit interest, and the stability for the uninsured of a public option. So I think it's the best of both worlds, is the concept at least in the argument. I'm going to stop there, and I'm going to let you take a look at our article. It's very good, I think. I've spent the last week and a half reading 50 pro-con editorials, opinion pieces, and so forth on the topic, and distilling the arguments for you. So I hope you'll take advantage. Take care. I don't know how to use this.